So taking a closer look at a newsletter that was released by John Hopkins University. This is published by the students of John Hopkins. This is by Yanni Gu. This is as of November 22nd, right? So this came out just a few days ago. And of course, actually, excuse me, yeah, closer look. And of course, this was updated as of November 26, 2020. This is a closer look at the deaths due to COVID-19. And basically what this article is talking about is according to the new data, that new data will take you to a link to the Daily Mail where they compile all of the information in regards to all of the deaths and basically looking at a worldwide view. This is according to the U.S. According to the U.S., currently ranks first in total COVID-19 cases. This is new cases per day and deaths. Genevieve Briand, she is a teacher at John Hopkins University who teaches statistics and econometrics. She has many years of experience teaching numerous and varied economics and statistic courses. So she is a professor there at John Hopkins University. And she goes on to say, she is an assistant program director in applied economic master's degree program at John Hopkins. Critically analyzed the effects of COVID-19 on U.S. deaths, on the U.S. as deaths using data from the Centers for Disease in the webinar entitled COVID-19 Deaths, a look at the data. And she explained that the significance of the deaths can be fully understood only through a comparison to the numbers of total deaths in the United States. Right. So what they're basically looking at is they're basically looking at the graph of basically, when you go to the CDC, and I've looked at it before, and at least she compiled it much better. Basically, when you look at the graph, it shows basically a week by week of people who have passed away, right, from multiple years. And then part of the information was missing. It was missing a lot of the data. And I guess they must have recently just uploaded that data. Because when I looked last time, I didn't see some of the latest data from like the past couple of months. It was up to, I think, about like the first quarter in 2021. But she goes into it and she says here, surprisingly, the deaths of, oh, here we go. After receiving the data on the CDC website, Brianne compiled a graph representing percentages total deaths per age category from early February to September, which includes the period before COVID-19 detected in the United States to after infection rates soared. Surprisingly, the deaths of older people stayed the same before and after COVID-19. Since COVID-19 mainly affects the elderly, experts expected an increase in the percentage of deaths in older groups. However, this increase is not seen from the CDC data. In fact, the percentage of deaths among all age groups remains relatively the same, right? So the deaths, in terms of what they were saying, the easiest way, and like in videos that I did before in talking about in Africa, they said the exact same thing, where they said, even though we have poor testing, they obviously, the epidemiologists realized that even if we have poor testing, right, we're not sure who has the disease, etc. What they were doing was mostly drawing blood and doing serum analysis to show individuals who basically were positive for antibodies for the virus. But what they said was that while we do have poor testing, but we're not seeing the type of deaths that would dictate that we're basically here, that we have a pandemic. And so if anything, it said that the deaths were relatively normal. There was no excess deaths that were seen, even in places like in Africa. And I'll link that video with the information. And of course, we're going to go a little bit more in depth. There's one good point that she makes out. I believe it's over here where she says, Brianne also noted that 50 to 70,000 deaths are seen both before and after COVID-19, indicating that this number of deaths was normal long before COVID emerged. Therefore, according to Brianne, not only has COVID-19 had no effect on the percentage of deaths of older people, but it has also not increased the total number of deaths. The data analyzed suggests that in contrast to most people's assumptions, the number of deaths by COVID-19 is not alarming. In fact, it's relatively no effect right? Relatively no effect on deaths in the United States. This comes as a shock to many people. How is it that the data lie so far from our perception? And then she later goes on to say, versus all of this points to no evidence that COVID-19 created any excess deaths. Total deaths numbers are not above the normal death numbers. We found no evidence to the contrary, Brianne concluded. And there's one more point here I wanted to go over. It says right here, in an interview with the newsletter, Brianne addressed the question of whether COVID-19 deaths can be called misleading, since the infection might have exacerbated and even led to the deaths of other underlying diseases. And this is where she says, if the COVID-19 death toll was not misleading at all, this is what we should have observed is an increase in the number of heart attacks and increased COVID-19 numbers, but a decreased number of heart attacks and all other deaths doesn't give us a choice, but to point to some misclassification. In other words, the effect of COVID-19 on deaths on the United States is considered problematic only when it increases the total number of deaths or the true death burden by a significant amount in addition to the expected deaths by other causes. Since the crude number of total deaths by all causes before and after COVID have stayed the same, one can hardly say, in Brianne's view, that COVID-19 deaths are concerning. This is the CDC classified all deaths that are related to COVID-19 simply as COVID-19 deaths. Even patients dying from other underlying diseases but are infected with COVID-19 count as COVID-19 deaths. This is likely the main explanation as to why COVID-19 deaths drastically increased while deaths of all other diseases experience a significant decrease. And I had talked about this in another video where, according to the Center for Infectious Disease Research and Policy, and this is according to the University of Minnesota, and this was in the Southern Hemisphere, right, in places like Australia. This is the Southern Hemisphere had a very light flu season in 2020, with Australia seeing only 315 cases over its winter, down 99.8% from the 130,000 cases in most years. But flu experts say that while the numbers can portend a similar scenario in the Northern Hemisphere, it would be foolhardy not to prepare for the high caseloads this winter. Right? So basically, in the Southern Hemisphere, the flu virtually disappeared. And then people in the north were like, well, just because it disappeared in the north doesn't mean it's going to disappear here. Just because it disappeared in the south, it doesn't necessarily mean that it's going to disappear in the north. And that's basically what we're seeing in the US. And of course, this just goes to show you that everything that people have been saying for quite some time, that COVID-19 has been overly exaggerated. Literally, it has had no impact, according to the data that she's analyzed, right? According to John Hopkins University professor, according to the data that she's analyzed, it's literally had no effect. And one has to ask, President Trump had made a comment in one of the rallies.
You know, in Germany, if you have a bad heart and you're ready to die, or if you have cancer and you're going to be dying soon, and you catch COVID, that happens, we mark it down to COVID. You know, our doctors get more money if somebody dies from COVID. You know that, right? I mean, our doctors are very smart people. So what they do is they say, I'm sorry, but, you know, everybody dies of COVID. But in Germany and other places, if you have a heart attack or if you have cancer, you're terminally ill, you catch COVID, they say you died of cancer. You died of heart attack. With us, when in doubt, choose COVID.
And there was an interesting video that I'll link. We'll take a look at it now.
If someone with COVID-19 is hospitalized and passes away, does the government reimburse hospitals more for that type of care? It's a question some of our viewers have been asking. News 8's Shannon Handy looked into the issue and has details in this Verify report.
Hospitals do get reimbursed when caring for patients on Medicare, including those with COVID-19. Medicare is a government-funded insurance program for those 65 and older. The question is, how much are hospitals getting, and are they inflating the numbers? It's a topic circulating on social media, and News 8 viewers want to know more about. We received an email stating, quote, "My boss heard from a doctor that hospitals are paid $9,000 each listed COVID death." Another person claimed a friend's relative, quote, "just passed away from cancer," but when they received the death certificate, the death was listed from COVID-19. When they questioned the hospital about it, the hospital told them that this is what they were told to do because the hospital gets $37,000 per COVID-19 death. How often is this happening? We can verify hospitals do get paid more for COVID-19 related cases. A provision in the Coronavirus Aid, Relief, and Economic Security, or CARES Act, pays an additional 20% on top of traditional Medicare rates during the public health emergency. How much are hospitals getting? The numbers vary. During a television interview, a Minnesota state senator said it was $13,000 for someone admitted with COVID-19 and $39,000 if they were placed on a ventilator. But those estimates have not been verified. According to a Medicare spokesperson, while hospitals do get reimbursed more for patients on ventilators, quote, "Medicare adjusts hospital payment based on geographic variation in local costs." Finally, are hospitals inflating the numbers? While it's possible, there's no proof of it happening. That same Medicare spokesperson told us claims with inaccurate diagnosis, or DRG, would be subject to recoupment and/or other potential civil or criminal charges for false claims. To date, we couldn't find any hospitals cited for making inaccurate claims on discharge papers or death certificates.
Why a couple of months back, the CDC had basically downgraded, I think it was back when the COVID deaths were around like 160, and then the CDC said that only about 6% of the people who, when they looked back at all the data, that they said that only about 6% of the people who had passed away from COVID-19 was just COVID-19, and literally everybody else in the data had things like high blood pressure, diabetes, obesity. And so the only real way, of course, to go back and is to basically look at all the data to see why the person was admitted, and then basically follow the patient's chart all the way through to the end, because of course, notes are written, vital signs are taken, and so you can basically see what the person was in the hospital for. And I've said this before, I've had patients who have come into the hospital who have died, who were tested positive for COVID, but were not in the hospital for COVID, or individuals who did come into the hospital that, of course, tested positive for COVID, but then none of these individuals were in the hospital for COVID, or even were symptomatic for COVID. Most of them, the ones that I had, were there because they had missed dialysis. And of course, if you miss dialysis, you're going to have shortness of breath. But of course, this is just really important information to have, and of course it sheds light on what's basically going on. But of course the real question is, why is this, what is the real purpose behind basically all of this misinformation that we've had over the past couple of months? It's not just something, of course, that is limited to the United States, because we're seeing it basically across the globe.